This lecture will cover Chapter 17, Vaginal Secretions. Vaginal fluid secretions could be collected to test for forensic testing in assault cases or to diagnose infections and inflammation of the vaginal cavity, or to check for complications that can arise during pregnancy. Now, with pregnancy, we worry about rupture of the membranes and detecting if in fact the rupture of the membranes has taken place, or in other words, the water has broke. And with that, you're looking for the placenta alpha-1 microglobulin protein, or you're looking for the insulin-like growth factor binding protein 1. If we're looking for preterm delivery, then we would do a 5-volfetal-nectin enzyme test. Most of your clinical laboratories or hospital physician's office, reference lab laboratories don't deal a lot with the forensic analysis, so we're going to kind of just skip to the other components. So with vaginitis, what that is inflammation or infection of the vagina. And one of the most common conditions in female patients, and is often characterized by abnormal vaginal discharge, odor, vaginal irritation, painful urination, or painful intercourse. Vaginitis is secondary to bacterial vaginosis, vulvovaginal candidiasis, or a yeast infection, trichomoniasis, or an infection with trichomonas. And it can also occur with any sort of non-infectious conditions like vaginal atrophy, allergies, or even chemical irritation. Specimens would be collected by the provider during a pelvic exam, and they would do this by swabbing the vaginal walls or collecting some of that fluid that has pooled in the vaginal cavity. To do this, they will use a sterile polyester tip swab that has a plastic shaft. You cannot use cotton-tipped or wood shafts or the calcium agenate swab. So this is something that you always want to be sure that the provider is provided with the correct collection tube. A lot of places will have prepackaged tubes that will already have a little bit of the saline in there because it does require 0.5 to 1 ml of saline. Then you'll use that to kind of mix around, get those cells off of that tip of that swab. And so you always want to be careful. If someone comes to the lab looking for a swab, then you want to make sure you know what test they're doing, because the swabs are not interchangeable from kit to kit, or for example, doing a wet mount swab, that would need to be a specific swab, so they would need the wet mount containers for that. And so it would go into some sort of transport container and taken immediate to the lab so that it can be examined pretty promptly. It will be maintained at room temperature, and that is just so that you have easier recovery of some of your more temper sensitive organisms like your Trichomonas vaginalis. In order to be sure that you maintain that motility of that organism, you do need to examine it within 2 hours of collection. If additional testing needs to be done, like a chlamydia test or the herpes simplex virus, then that sample would also be collected separately, because that would need to be refrigerated to prevent any sort of overgrowth of normal flora. The normal color and appearance of vaginal discharge should be white and flocculent. Now, flocculent meaning can mean woolly, but when we talk about it in the lab term, we're not talking about woolly discharge. It's actually just more consistent. It stays together, so it's more like a mucousy type of a discharge that is white, not necessarily that it's woolly. So with our microscopic examination on a normal vaginal fluid, there is a predominance of large rod-shaped organisms, and these are gram-positive organisms that are just normal flora, the lactobacilli. And you may have heard of lactobacilli when we talk about some of your yeast that is found in some of your probiotic type of yogurts. Squamous epithelial cells will be in abundance just because that is skin cells that coats that vaginal wall. You may have white blood cells present. Doesn't necessarily mean that there is an infection, but if you have a very large increased number of white cells, it could alert you that something is going on, some type of inflammation. And of course, red blood cells could be present if there's menstruation or any kind of vaginal trauma or tears or anything. Also, occasionally there are some people that have kidney stones so bad that their urethra will actually leak, so you could get some cross-contamination there as well. Now for abnormal color and appearance, if it appears like it's a very increased and thin, it's a very watery type discharge that's white to gray, then that could be consistent with bacterial vaginosis. If it's a white, thicker cottage cheese type discharge that's more clumpy, that's usually consistent with a candida infection or yeast infection. A yellow-green frothy type discharge would be suggested of Trichomonas vaginalis, and a yellow opaque discharge would be indicative of or suggests a chlamydia infection. When testing vaginal secretions, of course, we do want fresh secretions. You don't want specimens that have set out for a while or were laid around somewhere on a counter or been transported in a routine transport, so it's been riding around for a few hours. You want to test these immediately because, again, some of those organisms are very temperamental. So the physician or provider, when they're actually collecting those specimens, they will do it while they're doing a pelvic exam. And while they're doing that pelvic exam, they will also go ahead and test the pH. Usually it's some sort of pH paper that they use to do that testing. And then after that, you would do the saline wet mount prep, possibly a KOH prep, and then a gram stain. So depending on where it's being tested at, usually like your OBGYN or your physician's offices, they'll probably do the saline wet prep and the KOH. Doing it in a hospital type setting, emergency room type setting, you could possibly get all three of those, or you may just get the saline wet mount. They may not do a KOH or a gram stain request. We can also do DNA probe testing to check for some of the different organisms that can infect the vaginal tract. We can set up cultures, and there's also some point of care type tests that can be performed now as well. The vaginal pH is maintained at around 3.8 to 4.5, so it's a very acidic environment, and that's due to the presence of the normal flora of lactobacilli, which, as their name implies, they produce lactic acid. So this lactic acid actually prevents the overgrowth of anything infectious, and it maintains the balance of the normal vaginal flora. If patients have a pH that's at that upper end, around 4.5, then that can be consistent with a yeast infection. And then once you start getting higher numbers than 4.5, then it is indicative of other processes like bacterial vaginosis or a Trichomonas infection. When we talk about microscopic procedures, we talk about a couple of different tests that we can do, like saline wet mount, KOH prep, or looking at the sample with a gram stain. And so slides are prepared from the collected saline specimen solution. So once it's placed into that collection tube with that 0.5 to 1 ml of saline, then you can actually take that swab and roll it on the slide to prepare it, or you can take a drop of that liquid that's in that sample and prepare those slides. So for a wet mount or a KOH prep, we will look at those organisms on a 40x objective, so this is your high dry. And then for a gram stain, of course, we would look at that on our oil power or 100x objective. For a wet mount examination, just as the test implies, it is wet. So with your wet specimens, you're going to use a cover slip, and you're also not going to go above 40x. So you would actually start on your 10x objective, get everything in focus. With your 10x objective, you're looking for even distribution of your cellular components. You're looking at the different types of cells, the number of cells, looking to see if there's any sort of clumping, anything that stands out. And of course, you're looking for the presence of budding yeast or yeast with pseudohyphae, and so sometimes those can take up large areas. So looking at it on 10x, then you can kind of get an overall picture. And you can also kind of scan the outside edges of that cover slip for anything that may have flowed out to those edges. Once you've examined it and gotten it focused on your 10x, you'll switch to your 40x objective. And this is where you'll actually do your enumeration, and you will count any cells that are present, note anything that's present. And specifically what we're looking for is white blood cells, red blood cells, any sort of epithelials or epithelials that look abnormal, bacteria, parasites, and yeast. So when we talk about epithelial cells in the vaginal or the urinary tract, the urethra, we talk about typically what we see are our squamous epithelial cells that coat those linings. And our squamous epithelial cells are about 25 to 70 micrometers in diameter, and they have that flagstone polygon type shape to them, or most of us kind of refer to it as like a fried egg type look, where you've kind of got in the center, you've got that prominent nucleus, and then that cytoplasm on the outside of that cell gives you kind of, you've got that yolk with the white, the fried egg white appearance to it. Now, clue cells are just epithelial cells that have a lot of bacteria that's attached to them, so they kind of get like this shaggy, rough look to them. There's going to be some great videos for you to watch to actually see some examples of this. This image here is actually of a sample that has a dye in it, so you can actually see that bacteria coated on that cell. So if a predominant part of your cell, at least over 50% of your cell, is covered with bacteria and it's got that rough edge around it, or you see a lot of bacteria, sometimes you can't even see the nucleus in it because there's so much bacteria, then that is indicates a clue cell and indicates bacterial vaginosis. So we can also have white blood cells. It's predominantly going to be your polymorphonuclear white blood cells, your neutrophils that you will see present in your actual vaginal secretions. If your white blood cell count is greater than 3+, and I think there is a chart in your textbook that kind of explains how to quantitate these. But you would have to basically go by the criteria that's established for your facility as far as quantitation. But if you see greater than 3+ white blood cells, then that would suggest that you do have some sort of irritation infection going on, whether it's a yeast infection or bacterial infection. With your red blood cells, they can distort a little bit in those vaginal samples. So they could, be crenated just a little bit. Their outside shell could kind of shrink a little bit. You might have some odd shapes or color variations to it. They're normally just going to be present if there's menstruation, but sometimes you can have inflammatory processes or some kind of trauma, tear, just irritation in general that can cause red blood cells to be present. They're often confused with yeast. They do have a very similar look and wet mount, so in order to distinguish those, you could either use KOH, which would dissolve the red cells. So if you look in there and you think you've got yeast and then everything's gone, then you know you've got red blood cells. However, some of the stuff is gone, but you still have those budding yeast present, then you know you've got both. You could also, what you're looking for is just making sure that you actually see the presence of that budding in order to call it a yeast. But you do want to make sure that you do become very familiar with distinguishing yeast from red blood cells. In my personal opinion, when you're looking at them on the microscope, the yeast have more of a greenish yellow type hue to them, whereas our red blood cells tend to have more of a brownish green tint to them. So as previously mentioned, uh, the vaginal canal has a lot of normal flora, and that's just to kind of help maintain that environment. You know, that's the area where babies are made and babies come out. So our bodies have a natural way of keeping that environment as sterile as possible. And so it does that by maintaining some normal bacteria in there, so those good bacteria. Um, One that you're probably going to be most familiar with is that lactobacillus, and that is because you can find it in your yogurt products. There's also some other ones, some diphthroids, some coag-negative staph, some various streps, some alpha hemolytic streps that can be present as well to kind of help maintain that balance of normal flora. You can see here just an image of just some those gram-negative rods and a couple of, it looks like probably some cocci of some sort. They're not really chaining or anything, a couple of pairs. And then what you're looking for is any kind of alterations in that normal flora can actually cause overgrowth of anything that's opportunistic, so anything that could potentially be introduced, any kind of bacteria or parasite, anything like that. And of course there, if your lactobacillus is decreased and it ends up being replaced by any of these other organisms that could potentially be a pathogen in that area, then you can have some shift in that normal flora, which is going to allow for some of these things to grow and then cause that bacterial vaginosis. And so you will actually study these a little bit more in depth once you get into microbiology. So for now, it's just more or less just knowing that there are a variety of organisms that can infect the vaginal tract. The most predominant one that we see or we associate with bacterial vaginosis is going to be the Gardnerella vaginalis. Trichomonas vaginalis is actually a parasite, and this is one of the flagellated protozoa. And so this particular parasite is sexually transmitted. It is an oval shape measuring about 5 to 18 micrometers. And it has 4 anterior flagella. So you can see those little flagella coming up top here. And then it's also got this little undulating membrane. Sometimes if you get a really good specimen, you can really see this little undulating membrane move along the side of it. So these flagella and this little undulating membrane allows it to actually kind of swim around. It'll go around in circles. It'll have a real darty, jerky motion to it. And so these things are a little bit temperamental, so that's why once it's outside of its environment, then it doesn't live very long. So you want to get this sample to the lab really quick so that you can test it. So, and that's because if those things stop moving and you do not see movement, then you cannot report it. Even though you know it is trichomonas, you can't report it because it could be that the patient maybe was previously treated and just, you just happen to get some dead cells in there. So that's why it's very important to make sure it gets sent to the lab promptly and test it promptly. So if you get this in there, even though it's not really a stat test, it's not usually ordered stats, just depending on where you're at, you do want to kind of work it up as a stat and make sure that you get to it as soon as possible so that you don't lose any of that motility. If it's been more than about 2 hours from collection, you're really not going to see much of anything. Everything's going to kind of start losing its viability. And if they're not moving, you can actually mistake them with white blood cells. They do look very similar. Sometimes they're very similar in size. And also, as you would expect, because of the anatomy, you will sometimes actually see these in urine. They don't live quite as long in urine because of that, the pH and the chemical composition of urine. It will kill those organisms pretty quickly. So sometimes you can see it in urine actually still moving. When we look at a specimen and trying to check for yeast, typically it's going to be the Candida albicans, but occasionally you can have some other species of yeast that could cause this infection. And so what you're looking for is you're actually looking for the presence of any sort of budding yeast. So budding yeast is where the parent cell is dividing off into a daughter cell, so it starts a little protrusion and then it kind of pinches off. So you can see several examples of budding yeast. It may have hyphae or pseudohyphae present, and don't worry about what these mean just yet. You just see these kind of filamentous root looking type structures here. You've actually got a little bit of budding going on here and here, but you have all of these hyphae that are present, and you'll talk about that, learn more about that once you get into your micro courses. This picture down here is just an example of a stained one, just so you can kind of see that budding a little bit better. And of course, again, as previously mentioned, if you're kind of confused if it's a red blood cell or a yeast, we're looking for the budding because red cells do not bud. And you could potentially do a KOH wet prep where you add the KOH, the potassium hydroxide solution, into that sample, or not the sample itself, but an aliquot of it. And then what that will do is actually dissolve those red cells and leave those yeast so that you could actually visualize those a little better. So to perform a KOH prep, it may also be known as an amine test, you would actually place a drop of your sample, or you would roll your swab onto your vaginal swab onto your slide, if this was being done at bedside, and you would drop to that 1 drop of your 10% KOH. I think the bottle says a minute maybe. You do want to give it just a few seconds though to actually dissolve. And then if you're doing the amine test, that's actually referred to as a whiff test, and what you're doing is you'll just kind of waft over top of that sample to kind of spread any kind of odor or fishy odor of those amines as it reacts to that KOH. You would actually smell for the presence of those amines or that fishy odor. And so if it is positive, if you do smell that fishy odor, it would suggest bacterial vaginosis. The KOH will actually dissolve the epithelial cells and the red blood cells, but it would leave the yeast cells. And then confirmation could additionally be confirmed with gram stains or a culture, DNA probe testing, or point of care testing. But typically, if clue cells are present, they'll diagnose bacterial vaginosis. Sometimes we'll do a whiff test, but that's not really probably done much anymore unless it's being done in a physician's office at bedside. So by actually doing a gram stain, that would kind of narrow down what the organism is that's causing the infection. I'm not sure that many physicians do this very often unless it's a patient that maybe they're having a problem actually treating the patient from what they usually routinely would treat a bacterial vaginosis infection with, which is usually going to be some sort of broad spectrum antibiotic, really powerful antibiotics. But they may potentially could order a gram stain if the patient is not responding to therapy. One of the other things that is used to actually diagnose the bacterial vaginosis would be a Nugent score. And so with this, they would actually tally up the points based on specific criteria, and then based on that criteria, where those points values fall will suggest whether or not it's bacterial vaginosis. I don't know that many physicians use this though in standard practice. Cultures could be performed for vaginal specimen, especially if they think that they're looking for something odd or unusual that doesn't typically grow there. But more specifically, what's going to be commonly found would be yeast. They're just growing on a blood agar plate, chocolate plates, you could find those yeast present. Trichomonas would grow, but it does require special media. There are various commercial transport systems that kind of help to preserve Trichomonas for some of the culture methods and things like that, but I don't know that many places culture for Trichomonas anymore. As technology advances, we're seeing more of this stuff switching over to automation. So some of these things will actually be checked for now using PCR testing or some sort of DNA hybridization probes. So some of the old methods of doing wet mounts and gram stains and actually setting up cultures is being replaced with some of your kit tests or your DNA tests, your PCR tests, to give you a more rapid diagnosis. There are a few point-of-care tests or rapid kit tests that are out there and available. Those tests are actually looking for the proline aminopeptidase that is present in the vaginal secretions due to the Gardnerella vaginalis. And then there's some rapid kit tests for Trichomonas, as well as some of your other organisms. And so these are kind of ran pretty much like a pregnancy test, where part of that vaginal sample would be placed into that detection system, and then of course you would give it time to perform, and then you're looking for positive, negative line type reactions. Bacterial vaginosis is the most common cause of vaginitis that affects women, about 40 to 50% of women that are of childbearing age. And this is due to that imbalance of that normal flora that resides in the vaginal tract, most specifically the lactobacillus that is responsible for maintaining that pH. So if there is an odor or increase in any sort of abnormal vaginal discharge, that could be due to the mix of this flora, being lower, or some sort of pathogenic organism being introduced. And this is usually going to be more apparent after intercourse, when that odor or that discharge is going to pick up. You can also see this to be associated with new or multiple sexual partners, and that's just because you're being introduced to different flora. Within frequent douching, use of intrauterine devices or the IUDs, pregnancy, or just by having the lack of that lactobacillus, so your normal flora has been decreased. And this could be due to something like antibiotic use or any sort of immunosuppressive states, any kind of anything that may have entered the vaginal area that decreased that fluid, that normal flora. Potential complications from bacterial vaginosis could include pelvic inflammatory disease, endometriosis, or you could have an increase of other sexually transmitted diseases. So there are some treatments that are available out there for treating bacterial vaginosis. So if a clinician has a patient that presents with most of these symptoms here, with the thin, white, homogeneous discharge, a pH that's greater than 4.5, they do the KOH prep at bedside and do that whiff test, and that's positive, they can pretty much call it right there. But if they're still going to look under the microscope just to make sure there's not multiple things going on, and then once they're under the microscope, they're of course looking for the presence of those clue cells, and of course they're looking for anything else that might be present as well. So Trichomonas infection is going to be sexually transmitted, and it is often associated with other STDs. So if Trichomonas is present, it's not a bad idea for the clinician to go ahead and check for other STDs. Vaginitis in women, and sometimes uretitis in men, can be caused by Trichomonas. These characteristics for the discharge would include green to yellow frothy vaginal discharge, an odor, irritation, pain with urination or with sexual intercourse, any kind of inflammation of the vaginal area, or the external labia, or a strawberry cervix, so that whole area just is inflamed. So it would be diagnosed using a wet mount. You're looking for that jerky motility. The test should be performed within 2 hours of collection. It could also be presented with white blood cells and lactobacillus in that wet mount with that trichomonas, with a pH of around 4.5, greater than 4.5, a positive whiff test, and of course you could treat it with antibiotics, and there are some new treatment methods that are out there too. A Candidiasis infection, of course, is a yeast infection that is caused by the Candida species. There are some non-Candida albicans species that can cause this infection as well, but typically it's the Candida albicans. And what usually happens is that there's a change in the vaginal environment, whether it's something like contraceptives, your hormone levels change, you've used antibiotics, something has disrupted that normal flora, which allows an overgrowth of those yeast cells. It can also be seen in immunocompromised patients, so this would be patients that have diabetes, iron deficiency, HIV. Patients will present with symptoms like itching, burning, pain. Of course, that's that curd-like or cottage cheese-like discharge. The pH is still going to kind of stay within that normal range. In order to diagnose it, of course, you would do a saline wet prep or KOH prep, or even possibly a gram stain. And of course, you're looking for those buds. Could be present with large number of white blood cells, lactobacilli, and you could see some clumping of the epithelial cells. You could culture this, or you could do the DNA hybridization methods to confirm it if you need to. Most physicians are just going to treat it. They're not going to confirm it unless treatment is not working. Of course, there are over-the-counter treatments as well as prescription treatments. And this is not usually being associated with having any sort of sexual transmission. That's not to say that it could not happen, but it's just typically not associated with being sexually transmitted. So some of the other things that we would look for in vaginal secretions would be to kind of check for any kind of complications that can arise during pregnancy. So more specifically, we would look for the premature rupture of the membranes, or just rupture of the membranes in general. If there's a question of whether or not someone's water has broke, then they could do this test, or to see if mom is at risk for preterm labor. The risk of premature delivery can be caused by the premature rupture of those membranes, and so once that amniotic fluid releases, then it can start to initiate the premature labor. And so what that can do is actually create an environment where infection can take place. You can start having fetal distress, problems with the umbilical cord, just a lot of things that can happen. So, you always want to keep baby in there as long as possible so that baby can continue to grow. So it's very important that if a patient presents and they think that that their water has broke and it's early in that pregnancy, to verify that it really is that amniotic fluid and not just urine leakage from the baby kicking on the bladder. So there are a few tests out there that can be performed. The fetal fibronectin test, of course, is going to assess whether or not a patient is at risk of early delivery or increased risk for delivery. And so fetal fibronectin is an adhesive glycoprotein in the extracellular matrix at the maternal and fetal interference in the uterus. So it's where mom and baby kind of butt up against each other, where baby's placenta meets mom. So the fetal fibronectin is elevated in about the first 24 weeks of pregnancy, and then it diminishes. So if it's present in vaginal secretions beyond 24 weeks of gestation, then that's going to be indicative of preterm labor or delivery. The specimen, when it's collected, they collect it using a swab, of course, and there's a couple of different methods that they can do that testing. So they could use ELISA testing or lateral flow testing, or even some of the rapid kit cassette testing where they're looking for a qualitative result of positive or negative. And so once that fluid is collected, that test would be run, but that swab does need to be free of anything that could interfere with it, like lubricants or any kind of cleansing agents for the vaginal area. The amniosure test is a qualitative rapid test that is based off the immunochromatographic technology. And so it's basically another kit test is what it is. And what it is looking for is for that PAMG1 marker. And the vaginal sample is collected, and then a test should be immediately performed. However, if it is delayed, it should be refrigerated. And then the test is going to be read either as soon as you see a positive result or within 10 minutes. And of course, you're looking for the presence of 2 lines versus 1 line. The actin prom test is going to detect the IGF-BP-1 protein. So similar to the other kit test where you're looking for a reaction in that test strip, and you're looking for 2 test lines versus 1. In this particular test, it does not have the interfering substances like some of the other tests do. So this is actually a pretty good test as far as not having to worry about anything interfering with it. The ROM Plus test, again, is another test device. This one actually detects both alpha fetal protein, and it detects the IGF-BP-1 protein, and that kind of helps improve its sensitivity. And so the swab is, once the swab's collected and tested, then what you're looking for again is the presence of 2 test lines versus 1 test line.